We know that food is so important in terms of how we socialize, in terms of culture, and how we connect with people. And so many of those moments in people's lives involve food.
When you talk to an individual with PKU, what is the most important thing for them? And what are they looking for a treatment? The number one thing they are going to tell you is diet normalization.
Thinking about how a patient or how a family is moving through holidays, celebrations, and how that patient feels being in a room full of people and not being able to potentially consume what they're consuming, or always having to have something special, something different.
And then with regard to their neurocognitive and neuropsychiatric function, we have to pay careful attention to that because many of our patients are not functioning at an optimal level. They may not be functioning, to the extent that their genetic potential would have allowed them in the absence of, their PKU.
We look at their neurocognitive function, we look at their attention, we look at their executive functioning, but we also need to look at their quality of life. And the main component that impacts them, like any of us, is our diet.
We can think about the different time points throughout a patient's journey, starting even when they're young, in kindergarten, in elementary school, thinking about what it means to take their medical formula multiple times a day. Are they having to step out of the classroom and take it in the nurse's office? Are they comfortable pulling out their formula and drinking that at the lunch table with their friends?
One of the individuals that, with PKU that I work with, she said she is striving for a treatment that will allow not diet liberalization, not diet relaxation, diet normalization. I want to have a normal diet.
Far too many times I've been in a visit with a patient where they've shared with me, I'm tired of feeling different. I want to feel like everybody else.